Have you ever wondered how aging affects your sexual health and what you should be mindful of as you get older? When we cross into our 60s, our bodies go through profound changes, and engaging in sexual activity can carry certain risks that aren't often discussed. This video will delve into the essential information every older adult needs to know about safely maintaining an active sex life, from potential health concerns to strategies for staying safe. Make sure to watch until the end, as we'll cover expert advice on how to enjoy a fulfilling intimate life while prioritizing your health and well-being. Let's ensure you're informed and prepared for this next chapter. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Marriage is a complex journey, far from a mere game. A successful marriage requires genuine commitment, regular nurturing, and a mindful investment of time and energy. Only with consistent care and attention will the benefits of married life begin to outweigh any hardships, turning shared dreams into reality. Yet, marriage is about balance. Understanding that, over time, relationships evolve, and certain aspects, including physical intimacy, require mindfulness and adaptation as we age. Physical intimacy in marriage is essential, but it needs to be approached with respect for one's body and age. Sushim Ma's book Tianyin Fong offers an insightful perspective on how the frequency of sexual activity should align with one's stage in life. He suggests that individuals in their 20s may find once every 4 days appropriate, by their 30s, once every 8 days, by their 40s, once every 16 days, by their 50s, once every 21 days, and as they enter their 60s, the frequency should naturally decrease or for some, cease altogether. While these are general guidelines, they highlight the importance of listening to one's body. For those in robust health, even in their 60s, once-a-month intimacy may still feel satisfying. This gradual adjustment ensures that physical demands align with a person's energy and capability, promoting long-term health rather than risking it. As we enter the later stages of life, often called the winter of life, health becomes an ever more precious asset. While some people may appear to defy age with boundless energy, this does not mean they are immune to the risks associated with overexertion. It's unwise to assume that one's body will always keep up as it did in youth. In Chinese culture, the intertwining of love and fate underscores that physical and emotional health should be preserved with respect and care. This applies to both men and women, too, should avoid adopting an attitude of invincibility. Maintaining health and harmony in a marriage isn't about pushing boundaries but about gracefully adapting to change. In addition to moderation, avoiding excessive indulgence is crucial for a fulfilling, sustainable life. One must pace oneself, especially in older age, savoring life's moments and refraining from impulsive behaviors that can lead to regrettable outcomes. The saying, "A single mouthful of food won't make you fat," reminds us that rushing through life, including the pleasures within it, can lead to burnout. Like a lamp that must be tended carefully, our vitality must be managed mindfully. Otherwise, we risk exhausting it prematurely. When indulgence turns into overindulgence, it often leads to unintended, sometimes devastating, consequences, eroding physical well-being and peace of mind. In marriage, loyalty and mutual respect are the foundation of a lasting partnership. Distraction or emotional neglect can create cracks in the marriage that deepen over time. As the initial excitement of a relationship naturally subsides, the foundation of love and respect must take its place. When mutual affection and emotional support are upheld, contentment follows, keeping the relationship strong and resilient. Conversely, if one allows the mind to drift toward desires outside the marriage, it creates distance, which not only jeopardizes the marriage but drains both mental and physical energy. Over time, such disregard can even strip away one's dignity and happiness, particularly in later years when companionship and stability are most valued. Gene Kelly, the iconic Hollywood star and legendary choreographer, known for his groundbreaking performances in musicals like Singing in the Rain, provides a poignant example of the importance of health awareness in later life. Although celebrated for his agility and exuberance on stage, Kelly encountered a serious health scare at age 71. During a physical encounter, he reportedly suffered a stroke, which left him with impaired speech and mobility. Although it's uncertain whether this incident was directly related to the sexual activity itself, it serves as a reminder of the potential health risks that older adults may face when engaging in strenuous physical activity. Fortunately, Kelly recovered, though his health remained affected thereafter. His experience highlights the need for older adults, especially those with pre-existing conditions, to exercise caution and understand their body's limits. To everyone watching this video, I encourage you to follow for more insights. Aging gracefully includes embracing the changes in our physical and emotional needs. Don't hesitate to revisit this video to reflect on these points, as our perspective on health and relationships may evolve with time. If this message resonates, feel free to like, comment, save, and share it with friends. Remember, as we age, our muscles and joints become naturally more vulnerable. Sexual activity, while beneficial for emotional and physical connection, involves movements and postures that may place stress on the body. For older adults, these stresses can pose risks, particularly if the body isn't prepared for such activity or if there are underlying conditions affecting the joints and muscles. Embracing a realistic approach to physical intimacy, one that honors the body's changing capabilities, can lead to a healthier, more fulfilling life for years to come. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Joint pain, particularly in the hips, knees, and lower back, is one of the most common issues that arises with age. As the body grows older, the likelihood of conditions such as osteoarthritis and cartilage degeneration increases, causing joints to become stiff, inflamed, or even swollen. These effects are especially noticeable after any physically demanding activity, including sexual activity, where the body may experience temporary flare-ups of joint pain, stiffness, and inflammation. This discomfort can last for several days, making routine movements or daily activities more challenging. For older adults whose joints are not adequately prepared or conditioned, there is a heightened risk of sprains, strains, or even dislocations. The natural wearing down of cartilage means that the cushioning between bones is reduced, leading to more friction during movement, which further exacerbates pain and inflammation. Muscle weakness also becomes a notable concern as we age. Starting around middle age, muscle mass gradually decreases, a process called sarcopenia, and the flexibility and elasticity of muscles also diminish. This decline in muscle health can become problematic if older adults attempt physically demanding sexual positions without the necessary muscle strength or flexibility. Those who have not been regularly active or are out of shape may find their muscles unprepared for physical exertion, leading to muscle soreness, stiffness, or even injury. Overexerting muscles without proper conditioning can result in strains or tears, which may require lengthy recovery times. Muscle strain is particularly risky for individuals who have a sedentary lifestyle, as their bodies may not be able to handle the physical demands of sexual activity. Osteoporosis, a condition where bones become brittle and more prone to fractures, is another major health concern among older adults, especially postmenopausal women. This condition makes bones more susceptible to fractures from minor impacts, twisting motions, or even awkward positions. Consequently, certain sexual activities or movements can carry increased risks, as even a slight fall or an awkward shift in position could result in a bone fracture. The added vulnerability of bones and joints further underscores the importance of physical preparation before engaging in sexual activity, as injuries in these areas can be severe and impact long-term mobility. To mitigate these risks, older adults should consult with their healthcare providers to assess their physical condition and determine whether they are fit for sexual activities. Engaging in regular stretching, strengthening exercises, and maintaining bone health are all essential for minimizing the likelihood of joint and muscle injuries. Practices such as yoga or gentle strength training can enhance joint mobility, muscle strength, and flexibility, making sexual activities safer and more enjoyable. Furthermore, listening to one's body is crucial. Any signals of pain, discomfort, or fatigue during physical activity should not be ignored. Avoiding positions that cause strain or overexertion can help reduce the risk of injury and ensure that sexual experiences are comfortable and fulfilling. In addition to physical health, older adults should not overlook the risk of sexually transmitted diseases, STDs. A common misconception is that as people age, their risk of contracting STDs diminishes, but this is far from true. Although the incidence of STDs may be lower in older populations compared to younger ones, unprotected sexual activity can still lead to infections. One primary reason for this risk is that many individuals in their 60s and beyond do not use condoms or other protective measures, either because they believe they no longer need them due to their age or because they are in what they perceive to be monogamous relationships. However, this assumption can lead to exposure to STDs, including HIV, hepatitis, syphilis, gonorrhea, and chlamydia. These infections are still transmissible through sexual contact, and older adults are as susceptible to them as younger people, particularly if they have multiple sexual partners or if their partners have histories of prior exposure. Older adults may also be more vulnerable to the effects of these infections, as their immune systems are generally less robust than those of younger individuals. This vulnerability can result in more severe health outcomes or complications if they contract an STD. Therefore, older adults need to take preventive measures, such as using condoms and regularly testing for STDs, especially if they are sexually active with new or multiple partners. By being mindful of these physical and health-related risks and taking the necessary precautions, older adults can maintain a safe and enjoyable sex life. Taking steps to ensure that one's body is physically prepared, respecting personal limitations, and staying informed about sexual health can go a long way toward reducing the likelihood of injury or illness and ensuring long-term wellness in one's later years. Engaging in high-risk sexual behaviors can have serious health implications, and among the most concerning is the risk of contracting HIV. According to the Centers for Disease Control and Prevention, CDC, HIV rates are notably high among young adults. However, in recent years, there has been a marked increase in HIV cases among older adults as well. This trend highlights the unique challenges faced by older populations, especially those who may be unaware of their HIV status or who do not consistently practice safe sex. Many older adults may assume that they are not at risk or may not be as proactive in discussing sexual health with their partners or healthcare providers, leading to a delay in testing and treatment. Hepatitis, another viral infection that can be transmitted through sexual contact, also poses a significant risk, particularly for older adults who have had unprotected sex or shared needles at some point in their lives. Hepatitis B and C, in particular, are highly transmissible through blood and bodily fluids, making them common among those with a history of drug use or unprotected sex. The risks associated with hepatitis in older adults are heightened due to age-related declines in immune function, which can make it more difficult for the body to fight off infections. Additionally, hepatitis can lead to more severe complications in older individuals, who may already be dealing with chronic health conditions such as diabetes, hypertension, or heart disease. For these reasons, older adults are often at a higher risk of serious health complications from these infections, including liver damage and increased susceptibility to other illnesses. Sexually transmitted diseases, STDs, in older adults are also frequently underdiagnosed. Symptoms of STDs, such as pain during intercourse, unusual discharge, or sores, may be misinterpreted as signs of menopause or other age-related health issues, leading to a lack of proper diagnosis and treatment. Some older adults may feel uncomfortable discussing their sexual health with their healthcare providers, leading to an underreporting of symptoms and potentially severe health consequences. The stigma around sexuality in later life, combined with a generation that may have less sexual health education than today's younger adults, contributes to this lack of open communication. As a result, infections may progress untreated, increasing the risk of transmission to partners and exacerbating health problems that could have been avoided through early intervention. To minimize the risk of STDs, older adults need to adopt preventive measures. Using condoms or dental dams during all sexual activity is recommended, regardless of age or relationship status, as it significantly reduces the transmission of most STDs. Regular testing for STDs is also important, particularly if they are engaging in new relationships or have multiple partners. Open communication with partners about sexual health history and testing can help foster a safe and trusting environment. Additionally, discussing sexual health with a healthcare provider can provide older adults with access to resources and guidance on maintaining a healthy sex life. By incorporating safe sex practices and regular screenings into their lives, older adults can reduce their risk of infection, ultimately allowing them to enjoy fulfilling and healthy sexual relationships while protecting themselves and their partners. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. As individuals age, they experience a natural decline in hormone levels, particularly estrogen in women and testosterone in men, both of which can have a significant impact on sexual health. For women, the decrease in estrogen levels, which occurs during menopause, triggers a range of physiological changes that can affect libido, sexual function, and overall satisfaction in intimate relationships. Vaginal dryness is one of the most common symptoms, resulting from decreased estrogen levels that impair the moisture and elasticity of vaginal tissues. This thinning and dryness of the vaginal lining can lead to discomfort or even pain during intercourse, which may, in turn, reduce a woman's interest in sexual activity. Additionally, These physical changes may contribute to a decrease in sexual desire, as the discomfort can overshadow the enjoyment of intimacy. In some cases, women may also experience difficulty achieving orgasm, further impacting their sexual well-being and quality of life. Beyond the physical effects, emotional and psychological factors also play a role in reduced libido and sexual satisfaction among aging women. A lower level of estrogen has been linked to decreased libido, and the overall changes in the body can lead to a sense of disconnection from one's sexual identity. For many women, the hormonal shifts associated with menopause come alongside other major life changes, such as retirement, children leaving home, or adjusting to new social roles, which can also impact their sense of self and desire. Chronic health conditions, stress, and depression, which are more common in older adults, can also worsen these symptoms, further reducing interest in sexual activity and complicating intimate relationships. Men, too, experience hormonal changes as they age, particularly a decline in testosterone levels. This gradual decrease usually begins around the age of 30 but can become more noticeable in later years, impacting various aspects of male sexual health. One of the most common issues linked to lower testosterone levels is erectile dysfunction, ED, which is characterized by the inability to achieve or maintain an erection firm enough for sexual intercourse. Lower testosterone levels can reduce libido, which may diminish a man's interest in sex. Some men may also find that the intensity of orgasms decreases or that the quality of their erections changes. Although ED is often attributed to aging, it can also be caused by other factors, such as cardiovascular disease, diabetes, or side effects from medications. Cardiovascular health, in particular, plays a crucial role in erectile function, as erections rely on adequate blood flow to the penis. When arteries become blocked or narrow, as can happen with age, it may become more challenging for men to achieve or sustain an erection. The impact of aging on sexual health is multifaceted, involving not only physical but also emotional and relational changes. While declining hormone levels contribute significantly to the physical symptoms, the emotional and psychological aspects of aging also influence sexual health and satisfaction. Older adults may benefit from open discussions with their healthcare providers about sexual health issues, as many treatments and therapies can help mitigate the effects of age-related hormonal changes. For women, hormone replacement therapy, HRT, or lubricants can alleviate vaginal dryness, while medications like phosphodiesterase inhibitors, such as Viagra, can be effective for men with ED. Psychological counseling, couples therapy, and open communication between partners can also be beneficial in addressing the emotional and relational dimensions of these challenges. By understanding the factors that influence sexual health in later life and taking proactive steps, older adults can maintain fulfilling and satisfying intimate relationships well into their later years. As we grow older, hormonal changes are a natural part of the aging process, but they can introduce challenges in maintaining a satisfying and enjoyable sex life. For many individuals, shifts in hormone levels may contribute to issues such as reduced libido, vaginal dryness in women, and erectile dysfunction in men. These changes can impact both physical comfort and emotional intimacy, which are vital elements of a fulfilling sexual relationship. Some people may choose to explore medical treatments to alleviate these symptoms. For women, hormone replacement therapy, HRT, can be an option. HRT can help restore estrogen levels, which may alleviate symptoms like vaginal dryness and low libido, making sexual activity more comfortable and enjoyable. However, HRT isn't suitable for everyone and comes with its risks, including potential links to certain cancers, blood clots, and cardiovascular issues. It's crucial to work closely with a healthcare provider to assess whether HRT is a safe and beneficial option based on individual health history and current condition. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. For men, medications such as sildenafil, Viagra, or tadalafil, Cialis, can help address erectile dysfunction, which often becomes more common with age as blood flow decreases and other health factors come into play. These medications can help improve sexual function and, as a result, contribute positively to intimacy and emotional connection. Yet, similar to HRT, erectile dysfunction medications must be approached cautiously, as they can cause side effects like headaches, vision changes, and, in rare cases, serious cardiovascular issues. Men who have heart conditions, high blood pressure, or are on certain medications should discuss all potential risks with a physician to avoid dangerous drug interactions and adverse effects. In both men and women, Communication with a healthcare provider is essential to navigating the physical changes associated with aging. Beyond medical treatments, lifestyle adjustments can play a powerful role in maintaining a satisfying sex life. Regular exercise can improve cardiovascular health, circulation, and muscle tone, all of which are essential to sexual function. Managing stress, eating a balanced diet rich in nutrients, and getting enough sleep all contribute to a healthier body and a more positive self-image, which can naturally enhance libido and intimacy. Advice for those over 60. If you are over 60 and still engage in sexual activity or self-pleasure, it's important to prioritize health and well-being to ensure that sex remains a positive experience. Aging brings changes to the body, and some health conditions may increase the physical demands and risks associated with sexual activity. Regular health checkups are vital. Consult your doctor about cardiovascular health, blood pressure, joint health, and mental well-being, as these areas directly affect your physical ability to engage in sex. For instance, cardiovascular health impacts stamina and endurance, while joint health can affect flexibility and comfort during physical activity. Mental health, too, plays a major role. Anxiety or depression can reduce libido, while a positive mental outlook can enhance it. It's also advisable to openly discuss any concerns about sexual health with your healthcare provider. Understanding how your body's needs change with age and how to address these changes effectively can make a significant difference. Your doctor may suggest treatments or practices tailored to your specific health profile to address common issues such as erectile dysfunction, reduced libido, or vaginal dryness. They can also recommend safe and effective products, such as water-based lubricants for women experiencing dryness, which can make sexual activity more comfortable and enjoyable. In your relationship, open communication with your partner is equally important. Aging can bring about changes in both libido and physical ability, and it's essential to have honest conversations about comfort, desires, and any limitations. Such discussions allow both partners to feel respected and valued, strengthening intimacy. Physical closeness should be a source of joy and connection, and setting boundaries together can make the experience fulfilling and respectful of each person's needs. Lastly, for those who may have new or multiple partners later in life, be mindful of protection. Sexually transmitted diseases, STDs, remain a risk at any age, and using condoms or other forms of protection is an important step in safeguarding health. As you consider these insights, reflect on the ways you can start making small, positive changes to enhance well-being and satisfaction. Embracing a holistic approach to health and intimacy can make a world of difference, allowing you to continue experiencing joy, connection, and fulfillment in your relationships. Taking the time to nurture yourself and your relationships fosters deeper bonds, bringing renewed intimacy, happiness, and peace of mind. As we come to the end of this video, let's take a moment to reflect. What have you learned from today's message? Is there one insight or lesson that resonated with you deeply? Something you can bring into your life starting today? We'd love to hear your thoughts, so please share in the comments below what you're taking away and how you plan to put it into practice. If you enjoyed this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel. Your support means a lot to us and helps us continue sharing these messages with more people. Thank you for watching, and we look forward to seeing you next time.